In Australia, around about 21% of residents are dispensed antipsychotics, 31% benzodiazepines and 38% antidepressants within 3 months of admission to a residential aged care facility. At PSA23, I'll be talking about the new clinical practice guidelines for the appropriate use of psychotropic medications in people living with dementia and in residential aged care. The guidelines have just been approved by our National Health and Medical Research Council in April this year, and I'll be discussing what some of the implications for pharmacists are. Appropriate use of psychotropic medication was identified as one of the 3 areas needing immediate action in the interim report of the recent Royal Commission into Aged Care Quality and Safety. In Australia, around about 21% of residents are dispensed antipsychotics, 31% benzodiazepines and 38% antidepressants within 3 months of admission to a residential aged care facility. In developing the new guidelines, we've put together 15 conditional recommendations and 49 good practice statements, and many of these relate to how we practice pharmacy. An example of those good practice statements is that the treatment end date should be recorded in the pharmacy dispensing history, and there should be a discussion with another healthcare professional involved in the direct care of the resident before an antipsychotic is dispensed for the first time. We have also recommended that all residents prescribed an antipsychotic, benzodiazepine or antidepressant should have an adverse event monitoring protocol to ensure that signs and symptoms of adverse drug events are identified and can be escalated and addressed so that hopefully we can prevent medication-related harm occurring. So come along to the session at PSA23 to learn about some of the new recommendations and good practice statements in Australia's new clinical practice guideline for the appropriate use of psychotropic medications in residential aged care.